Hi, my name is Claudia Montanera, and the topic of my video is acute methotrexate induced crystal nephropathy. Definition: acute renal failure occurs in approximately 2% of patients who receive high-dose methotrexate for the treatment of a hematologic cancer. Intratubular crystal formation thus occurs in humans during the course of methotrexate-induced acute renal failure. Certain types of urinary crystals are known to form or to undergo structural modification in the bladder or after micturations because of change in pH, temperature, or bacterial activity. Methotrexate for a little as 3 days in a row is enough to cause serious consequences, including sepsis and death. Since 2000, at least 8 Australians have died and many more have been hospitalized after taking too much methotrexate. Methotrexate use is increasing, which has corresponds with an increase in accidental daily dosing report to Australian Poisons Information Centers. Methotrexate is effective and safe if used correctly.
After starting a new drug. Most mild to moderate. Here are 5 things healthcare professionals should know about drug-induced kidney injuries. First, there are 3 main ways that drugs damage kidneys. Some drugs decrease how much blood flows to the kidneys. Examples include NSAIDs, ACE inhibitors, and ARBs. Some drugs directly injure kidneys. Examples include penicillins, cephalosporins, contrast dyes, and aminoglycosides. Some drugs also obstruct the flow of urine from the kidneys. A common cause is calcium stones from excessive or high-dose calcium supplementation. Second, patients at higher risk may include those aged 60 or older, experiencing dehydration, with diabetes, high blood pressure, pre-existing kidney disease, heart failure, or liver failure, or having recently had surgery or a procedure that used contrast dye. Third, symptoms can occur days or months after starting a new drug. Most mild to moderate kidney injuries do not have any symptoms. People with a severe kidney injury may complain of feeling tired or confused, a sudden increase in blood pressure, a sudden change in urine output, or swollen ankles and weight gain from fluid. Fourth, the most useful lab markers are an increase in serum creatinine by at least 27 micromoles per liter in 24 hours or by 50% in 7 days, a drop in eGFR by 25%, and/or a decreased urine output. Finally, patients who experience a drug-induced kidney injury may need to have their medication doses decreased or stopped altogether.
Application in medicine. Methotrexate is in a class of medications called antimetabolites. Methotrexate treats cancer by slowing the growth of cancer cells. Methotrexate treats psoriasis by slowing the growth of skin cells to stop scales from forming. Methotrexate may treat rheumatic arthritis by decreasing the activity of the immune systems. Methotrexate is also sometimes used to treat Crohn's disease, multiple sclerosis, and other autoimmune diseases.
Low-dose methotrexate is extremely effective for treating rheumatoid arthritis and other conditions such as psoriasis. It remains the gold standard treatment within the professional healthcare community and has helped many patients feel better, control their disease, and achieve remission. Taken once a week, methotrexate works by reducing pain and swelling and can slow joint damage and disease progression over time. There is also evidence that methotrexate may reduce the burden of heart disease in rheumatoid arthritis. There are 2 ways to take methotrexate, either as a tablet or an injection. Tablets enter the bloodstream through the digestive system. However, injectable methotrexate avoids the stomach and intestines, which may reduce side effects like nausea and diarrhea in some patients. You might be aware that methotrexate is also used in some cancer treatments. It's the same drug, but the dosage levels used are very different. Most people are greatly helped by methotrexate and cope with few, if any, problems. But like all drugs, methotrexate can cause side effects, and your doctor or nurse will closely monitor you for these. One concern some patients have when prescribed methotrexate is hair thinning. Hair thinning is a possibility, but it's usually slight. Another common concern is feelings of sickness, especially when taking tablets. Fortunately, there are steps you can take to help minimize this. Studies show that taking a folic acid supplement reduces side effects by up to 79%, and changing from tablets to injectable methotrexate is also proven to reduce stomach problems whilst increasing the effectiveness of the drug. As to methotrexate and alcohol, a recent study has shown moderate alcohol consumption of less than 14 units a week shouldn't have an adverse effect on your liver. That means you can continue to enjoy the odd drink while on methotrexate. Just ensure your doctor continues to monitor your bloods regularly. It may take up to 12 weeks after reaching the best dose for your condition before you notice any benefits, so persistence is key. Remember, at any stage, you and your doctor can agree to adjust or swap treatments. A healthcare professional should always be your first port of call for information. There are also advice helplines, websites, and patient groups.
Pros and cons. Pros. Methotrexate is one of the most effective medications to treat rheumatoid arthritis. According to the National Rheumatoid Arthritis Society, more than half of people taking it see a 15% improvement in the course of their disease. It will help ease symptoms like joint pain, fatigue, weakness, and swelling. It may also help prevent damage to your organs and joints. Cons. Acute tubular injury with numerous intratubular and interstitial deposits of unique appearance. Acute renal failure can occur even in the absence of toxic methotrexate levels in plasma. 24 to 48 hours after infusions. Antimetabolic levels in plasmas are better correlate with an increased risk of crystal formations than are the levels 24 to 48 hours after infusions. Increase the creatinine concentrations in plasma.
Methotrexate is commonly used to treat rheumatoid arthritis and many other autoimmune and inflammatory conditions. In fact, it's the first line of treatment for most people after they're diagnosed, and it serves as the gold standard against which other treatments are evaluated. Methotrexate can be used by itself, but also it's frequently combined with other medications to control your disease. Methotrexate works by turning down parts of the immune system that are revved up in RA and other conditions. It helps get your body's inflammation back under control. When people first hear about methotrexate, they're often concerned because this medication is also used to treat some forms of cancer. But it's very important to remember the doses that rheumatologists use are hundreds of times smaller than the doses used for cancer. Therefore, many of the side effects seen with chemotherapy are not seen with the lower doses. Methotrexate has been used to treat autoimmune conditions since the 1980s. Its safety record and the doses that rheumatologists use, which are about 15 to 25 milligrams a week, Guidelines for monitoring these side effects are all well established. In most people, methotrexate does not cause any problems. We also give a prescription for a vitamin called folic acid to take every day while you are on methotrexate. This helps to cut down many of the possible side effects. Sometimes another vitamin, folinic acid, or leucovorin, is also used. Methotrexate is taken once a week, not every day. It can be given as pills or in an injection. So you will choose a day of the week that works best for you, for example, Sunday. You'll then take your methotrexate every Sunday. Before taking this medication, your rheumatologist will check to make sure you're able to take methotrexate. You may not be prescribed methotrexate if you have cirrhosis of the liver or other liver diseases, if you have certain lung conditions, if you're a woman who is pregnant or trying to get pregnant, if you're a man who is trying to get someone pregnant, you have blood cell disorders such as anemia, which is a lack of red blood cells, or leukopenia, which is a lack of white blood cells, if you're breastfeeding a baby. Methotrexate can cause birth defects in the unborn baby. You should be on a sure method of birth control while taking methotrexate, whether you're a man or a woman. Tell your doctor right away if you become pregnant during your treatment. You may need to have a negative pregnancy test before starting treatment. Once you stop taking methotrexate, you should continue using birth control for at least 90 days before attempting pregnancy. Methotrexate is broken down by the liver. We generally recommend that people drink no more than 1 to 2 alcoholic beverages per week to minimize the chance of liver injury. Methotrexate comes in both pill and liquid form. Methotrexate pills usually come as 2.5 milligrams. You will be instructed how many pills to take once a week. For example, if your rheumatologist wants you to take 20 milligrams, that would equal 8 pills a week on your selected day. You can also take methotrexate by liquid, by mouth, and you will be given a syringe without a needle, and you would measure out the amount of liquid to take. A third way to take methotrexate is by injection. Your body may be able to process methotrexate better if it's given by injection. Also, injections may reduce upset stomach that methotrexate pills can cause. There are several types of injections with videos describing them. The links will be at the end of this video. Your doctor, nurse, or pharmacist can answer any questions you have about how much methotrexate to take and how often to take it. You want to store pills and injections at room temperature, away from moisture and heat. And if it's a liquid, store it also away from light. If you miss a dose of your methotrexate, talk to your doctor for instructions.
Issues apply in Ecuador. A great problem that exists in the world is disobedience on the part of the patients, since in some cases they want a quick recovery and begin to consume more than the recommended dose. In other cases, not having enough money, they decide to stop treatment abruptly. In both cases, the adverse effects are enormous and it is produced by the patient.
Hi, I'm Andrew Jordan, one of the rheumatologists at BJC Health. In today's video, I want to address one of the biggest myths about methotrexate, in that it is a chemotherapy drug. Methotrexate is actually used for rheumatoid arthritis and psoriatic arthritis, and it is used for chemotherapy. The main difference is the dose. In rheumatology, we use it as a tablet that you take once a week at a dose of about 20 milligrams on average. In chemotherapy, it is used as an infusion into the vein and usually given in very high doses, up to 3,000 milligrams or more. The dose difference is about 100 times. So as you can see, I liken it to whether you have 1 drink of beer or 100 beers. The side effect profile is going to be very different. A lot of the things you may read up online may be actually incorrect, as it's referring to this huge dose that's used for chemotherapy. At the doses we use, the actual side effect profile is nothing compared to the chemotherapy dose, and it is completely inappropriate to consider it a chemotherapy drug when it's used at the doses we use in rheumatology. I hope this answers the myth about methotrexate and chemotherapy.
Conclusion. The use of methotrexate is appropriate for the treatment of rheumatic arthritis and autoimmune disease, but it should be administered with great caution only once a week because its adverse effects are innumerable, such as liver damage, lung damage, a decrease in the number of those cells, increase the risk that you will develop lymphoma, life-threatening skin lesions. Therefore, it is essential to follow the doctor's recommendations and follow the treatment to the letter and not change the amount of dose prescribed by the professional.
Hey, this is Medicos Perfectionalis. Let's talk about urine crystals. So urine crystals are urine sediments that have specific shapes under microscopy. So if you know the shape, you can know what type of stone it is, and it will be of great help on your board exam because it will describe to you like the stone. Like for example, hexagonal shaped stone. It's like cysteine. Rhomboid, it's uric acid, etc. So that's the topic of today's video. So these are the most high yield crystals for your exam and for life. So first we have the envelope shaped crystals. These are the calcium oxalate. The mnemonic, or the way that I remember it, that calcium oxalate stones are the most common type of stones. So, the envelope is the most common shape that you see in your life. You receive and send mail all the time. So, calcium oxalate, envelope. Let's go to cysteine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6. Okay, especially if you know French or Spanish, it's pretty close. We have the struvite stone. Struvite stones are bad, like really bad. The shape is coffin, which is bad. Okay, the way I remember it, you can say struvite as starve to death, and death is related to the coffin, of course. Last, we have uric acid. They are rhomboid in shape. The way I remember it, uric acid, sometimes gout comes into mind. And in gout, the definitive diagnosis is to get joint aspirate, okay, to see these crystals, okay. And if you see them, they are negative birefringent and they are elongated. So here, this is the most elongated shape, okay, in this stuff. So uric acid, rhomboid. So envelope, calcium oxalate. Hexagonal, cysteine. Coffin shaped, struvite stones, the evil one. Rhomboid shaped, uric acid. I hope it's simple because it is. Now it is. And please subscribe, give it a like. You can.
And my social media. Thank you very much for watching my video.